Hi everyone, I'm Lynn Mikula. I'm PRHC's CEO, and I'm here with
Phil Oakley, your violence prevention specialist.
So Phil, you're not new to the organization.
No.
How long have you been with PRHC for?
I started in 2015, and I was in mental health first, and then went to medical outpatients, and then briefly back in mental health. And then I got this new position that was just created in March of this year.
And it's a position that sounds like it should be clear exactly what it is, but
Right.
we were just talking about how it's been evolving as you've gotten into it. So tell me, these days, how do you spend most of your time in this new role?
I would say most of my time is spent with the training of staff, the new hires, and we're moving into refreshers at the end of this year, beginning of next year.
This work that you're doing is really important because the pressure in healthcare has really gone up in the last few years, and there's a lot of emotion in these moments when people are getting upset. What is the number one thing that you would want everyone who works in the building to know to do in a situation where they're facing someone who may be getting upset or they think might be about to get a little violent or aggressive?
That's a great question. And to me, it's empathy, the strength of empathy, right? If you can meet people where they are and then help them from there, it's so important. Validating their experience and know that you're on their side as opposed to opposing them, you're with them in this experience.
It's got to be hard work. And people, it's hard to talk to people who maybe have had a difficult experience at work, but they haven't felt safe or they haven't been safe. So let's talk a little bit about debriefs, because that's another important part of what you do. Tell us how those come about. If someone needs a debrief, how do they connect with you?
This is great too, because I'm very excited. Some programs or departments already have it as the peer support program, right? And that is connected with our debrief. So we've looked at the debrief policy that we had, and now we've reshaped it to include the peer support. One thing is encouraging staff, because I think there was this idea around debriefs that someone else had to come in to do them, or it was someone else's job to debrief me. Anybody involved in a situation where you might need a debrief, anybody can start and organize it. You can do it with whoever staff were involved in that situation. You start there. And then the next phase of that is we have a number of CISM trained, which is critical incident stress management. We have a number of CISM trained staff in the building, and they can do a larger debrief. So we're having a step-by-step process so that staff feel supported all along the way and know that they feel free, that if they need it, they can just start it themselves and they reach out.
Phil, thank you so much for the work that you're doing. I know it's just getting started and we have a lot more to do, but you're making great strides and it's much appreciated. Thank you.
Thank you, Lynn.